Hi, this is Matthew Katz. I'm a radiation oncologist, and I'm trying to vlog at the request of e-patient Dave about something that I actually posted on the internet recently. I'm a new member of the Society for Participatory Medicine, and some of the conversations that have been taking place, the issues come up about what is an e-patient and what are some of the things that are involved in being an e-patient, and also what are the kinds of things we can do to empower people more. So I wanted to just put something together briefly to look at that from what my thoughts were and see what other people thought. I had been considering when I joined the society learning more about how doctors and patients interact, and there's been a lot of conversation about how to get patients more engaged. One of the things that struck me is some of the similarities of participatory medicine and the role of the patient to that in a participatory democracy. And in some ways, I would consider it similar to, if you look at patients' rights, making sure that patients are empowered. So while e-patient could represent electronic, engaged, a lot of other terms, to me it means empowered because that's the most relevant that then applies to all the others. So from that standpoint, the question I had, and that I've heard other people voicing, has been, how do you empower patients? How do you allow them to become more engaged into the decision-making process? And in thinking about how to motivate people to become more engaged, because many people choose not to be as involved in shared decision-making or in their own healthcare, is in looking at some other models. So I had chosen to look at a psychologic model, one by Abraham Maslow in his hierarchy of needs. And I'll give this to Dave, but this should be something that we could post, is I basically put together a patient's hierarchy of needs for quality care and for participating and being more empowered. The idea being that there's a certain fundamental need that you have at a base level, and in Maslow's description that was really physiologic first, then looking at safety, and then looking at other features as well. And in the setting of looking at this for our patients, it may differ a little bit, but for Maslow, for the psychology of motivation, it was really physiologic, then safety, love and belonging, self-esteem, and at the highest level was self-actualization. In what I put together, the first level was still physiologic, the idea that you had to be conscious, you had to have nutrition, you had to be pain-free, and you had to have enough rest to be able to function in the first place before you could talk about anything else. The next two levels really could be combined into looking at the quality of care and the care environment that you have. And that would be both having security, personal as well as in the environment that you're being taken care of, being in a non-critical condition and getting quality care. The other level to that would be really that you have caregivers, medical professionals, and friends in a support network that are really helpful to make sure that you're able to make decisions and be more involved. At the next level would be actually getting the knowledge you need to be able to make decisions, having the skill sets you need to actually act on those, as well as being able to evaluate your own personal values and have the self-esteem to make choices. Next level up, also part of empowerment, would be being able to be engaged in shared decision-making. Above that, and at the peak, is really looking at time. Time is sometimes a luxury we do not have in some medical decisions that we have to make, but if you do, for some diseases, you actually do have a chance to reflect further on whether or not you're making the right choice. So that's just a brief description of my reinterpretation of Maslow's hierarchy of needs, and this is for motivation to become an empowered patient. I'd be interested in hearing what other people have to say. I think it's one approach. There are critiques of Maslow's, and I'm sure there will be critiques of this as well, but I look forward to hearing what those may be. Thank you.